Good morning.
Good morning.
All right. I'd like to recognize Cook County Health CEO Israel Rocha, Dr. Lamar Hasbrook, Chief Operating Officer of Cook County Department of Public Health, Shannon Andrews, Chief Equity and Inclusion Officer of the health system, as well as Dr. Lakshmi Warrior and Dr. Urjit Patel. I'm pleased to be here today to highlight several new developments at the health system, all aimed towards helping us as a county achieve racial and health justice. First, the creation of a $14 million grant program to the Cook County Department of Public Health to support expanded access to behavioral health care in suburban Cook County. Funded with ARPA dollars, this grant program is aimed at enhancing mental health, youth development, and substance use disorder programming in areas that have historically been underserved where it's needed most. Our public health department has also launched a new health atlas, a data-rich resource providing insight into the health status of the communities that make up suburban Cook County. With the information gleaned from this data portal, our government, researchers, healthcare professionals, and community organizations can better understand the issues facing our residents and the interventions that may address health equities. And finally, Israel will be announcing several clinical leaders who will be spearheading advancements in key service lines to improve and equalize health outcomes for patients we serve in neurology, oncology, and cardiology. Cook County has made a commitment to achieving equity for all, including health equity. There are long-standing and pervasive systemic, institutional, and individual drivers that perpetuate racism, underinvestment, and injustice. We can't solve these issues overnight with the wave of a magic wand. It takes focus, investment, and resources. Everything we do must be centered around equity to ensure that everyone in Cook County has the opportunity to live a healthy and successful life. That's what we're demonstrating here today with our announcements. Brick by brick, we are paving the way to equity. Now to share more about the health system's equity efforts, I'd like to turn it over to Israel Rocha.
Thank you, President Preckwinkle, and good morning to everyone.
Good morning.
Good morning. So again, thank you, President Preckwinkle, for your commitment to the health system and for your passion to challenging the health and racial disparities that persist across our communities. I'm Israel Rocha, CEO of Cook County Health. Cook County Health has been at the forefront of equity for nearly 200 years. As one of the largest safety net health systems in the nation, it is our mission to provide comprehensive health care to everyone who walks through our doors. Regardless of their race, ethnicity, immigration status, or ability to pay, we have been doing the work of health justice since our inception, and we are proud to carry that work on today in both our current ways and new ways. As Cook County Health, we believe that health is a fundamental human right. This goes beyond just having access to medical care, but it also addresses access to safe housing, healthy food, education, and economic opportunities that allows that realization of healthcare to be true and to be a true fundamental right. We still see far too many inequities in healthcare and in health outcomes in our brown and black residents, stemming from these social risk factors for health: high rates of acute and chronic disease, more complications of illness, and lower life expectancy. It is not enough to simply acknowledge these issues exist. We must act to address these pervasive inequities at their roots. The first step in doing that is understanding and assessing the drivers of health in our communities where we are now. To that end, you will hear from Dr. Lamar Hasbrook about the Cook County Department of Public Health's new Health Atlas. He will also highlight an exciting new behavioral health grant program that furthers building our communities where they work. The second step is to creating and harnessing the clinical expertise and resources to end the delivery of care through a two-tiered system. That is why we have established the Change Institute of Cook County. With this initiative, we will tackle long-standing inequities by developing comprehensive solutions that will disrupt the hold that social risk factors have on our community. The Change Institute will seek to innovate, partner and borrow from other industries, and not rest until progress is achieved. Just like our collective response to COVID, it will require an all-hands-deck approach within and beyond our health system and its walls. As we look to operationalize the Change Institute, one of our first tasks has been to identify key service lines where we can optimize and integrate services to realize more equitable health outcomes. The first service lines of focus are oncology, neuroscience, and cardiology. These are the areas where patients often come to us with severe, late-stage disease, and where we feel we have the clinical expertise to reshape how care is delivered. I am proud to announce our new interim service line leaders who are with us here respectively, Dr. Urjit Patel for oncology, Dr. Lashmi Warrior for neurosciences, and Dr. Rami Duki for cardiac services. You will hear from Dr. Patel and Dr. Warrior shortly. But first, I would like to say a few comments in Spanish. Cook County Health ha estado en la vanguardia de la cuidad en la salud por casi 200 años. La salud es un derecho humano fundamental. Hay demasiadas desigualdades en los resultados de salud en nuestros residentes afroamericanos y latinos, quienes tienen tasas más altas de enfermedades agudas y crónicas, más complicaciones de enfermedades en una menor esperanza de vida. Debemos actuar para abordar estas desigualdades desde sus raíces. El Departamento de Salud Pública del Condado de Cook realiza encuentros para evaluar la salud de nuestras comunidades para podemos identificar los impulsores actuales de la salud y saber de cómo corregirse. Hoy también estamos anunciando nuevas subvenciones para programas de salud del departamento. También estamos desarrollando the Change Institute of Cook County, el Instituto de Cambio del Condado de Cook, para desarrollar soluciones integrales para interrumpir los factores de regreso social de la salud y para mejorar los resultados de salud. No podemos darnos el lujo de mantener el status quo cuando hay tantas vidas en juego. El trabajo de The Change Institute es para todos nosotros, para mejorar las vidas y extender la vida y la vivencia de nuestra comunidad. Now I am very happy to welcome to the podium Dr. Lamar Hasbrook, who will be talking about the wonderful programs that the Cook County Department of Public Health is doing to advance equity in our community and to hopefully resolve inequity across our health services. Thank you so much.
Thank you, Mr. Rocha. And thank you to President Preckwinkle for her support as well of the efforts in public health. So I'm Lamar Hasbrook. I lead the Cook County Department of Public Health. I'm going to say something briefly about the Health Atlas. It's been out for about a month or so, but what I will say is a very powerful portal for health information for suburban Cook County. We have over 150 or so health indicators, outcomes, drivers of health, determinants of health, socioeconomic factors, et cetera, and we've built in an inlay that aligns very nicely with the Change Institute and those priority conditions. And so you can go right to those priority conditions and drill down by region and by area. So I want to spend the bulk of my comments really talking about, not bearing the headline here, talking about the $14 million that we're going to be getting out into the community. I think we all know that COVID has really resulted in some ravages around mental health and behavioral health. Adults and children are experiencing very high rates of anxiety, very high rates of depression, some cases suicidal ideation, that is thinking about suicide, and a number of substance use disorders. So this has all been exacerbated in the age of the pandemic. Depression and anxiety have increased by 25% nationally in terms of the prevalence of that. And that was in the first year of the pandemic alone. And 50% of Americans report having symptoms of either anxiety or depression. So this is really unprecedented highs. 10% have felt that their mental health needs are actually not being met. So in a time where the rates are the highest, a time where the needs are the most acute and severe, it's often the hardest time now to actually get access to care, with the average wait time of about 25 days before folks can really get an appointment with their mental health provider. So people have mental illness, and things are related to COVID infection. Specifically, we call it long haul or long COVID. And some of these things can present as brain fog, again, anxiety or depression, PTSD, and also suicidal behavior. And while everyone's at some amount of risk, there are certain populations that are at higher risk. And these include children, mothers, and pregnant people, racial and ethnic minorities, those who have financial or housing insecurity, those who have fear of loss of job or fear of paying the rent, folks with disabilities, those with pre-existing mental illness or previous trauma, LGBTQ plus youth in particular, and those who are of low household income. So those are the folks that are most acutely at risk for the ravages of COVID with regard to their mental health. We also know the emotional development of children has been adversely impacted. Some of the risk factors for them include changes in their routine, having to work virtually or at home or in a hybrid situation, having to mask or physical distancing, missing their friends and other social contacts. So what can happen is stress can lead to distress, which can then escalate to mental health concerns and in some cases, frank mental illness requiring medication. So I'm pleased to announce, with that as a backdrop and the need, I'm pleased to announce that as a part of our Building Healthy Communities Behavioral Health Initiative, which is funded by ARPA dollars, as has been mentioned by the President, the Health Department is launching this call. We're calling it an open call. It's $14 million, an open call to the community. It's going to be $14 million over the period of 4 years. And any eligible municipality, health center, community-based organization, or schools are eligible for it. The grants will be ranging in the neighborhood of $250,000 all the way to $1.5 million. They are in alignment with Cook County's vision for innovative strategies and integrated solutions. We're trying to bridge the gaps and increase access to mental health prevention and treatment services, positive youth development, and harm reduction, specifically the opioid-involved overdose prevention. So this is a splash in the bucket. It's a drop in the sea, but we believe it's a very significant step in the right direction to close these gaps. So we're issuing an open call. What does that mean? That means we are really engaging in an unprecedented way to remove some of the barriers for those folks who can't really compete with grants or haven't had much familiarity with grants and things like that. So we're encouraging everyone from the 5-person volunteer-led organization in the church basement to regional health offices of education that are committed to the future of young people, to federally qualified health centers and community-based organizations. We want to work with you in partnering with you to address this problem and kind of close this gap a little bit and build this bridge one brick at a time. So to do that, we are having built-in technical assistance sessions, capacity building sessions, where we can actually teach you how to apply, get a solid application in. We can take you all the way to through the soup to nuts in terms of your program design, how to monitor, how to report, how to be in alignment with the legal requirements. So we're trying to open the tent, broaden the tent to have folks come in to get this money and, most importantly, make that impact on the ground. And so lastly, I'll just say this. We're starting accepting applications today, and that open period for the open call will be through December 7th, and those awards will be announced sometime around mid-January. So for more information, very important, the action step, you can go to bhcopencall.com, bhcopencall.com. That's Building Healthy Communities opencall.com. So thank you so much for that. And again, thank you for the support of Mr. Israel and President Preckwinkle. And with that, I'm going to call up my colleague, Shannon Andrews. Thank you.
Thank you, Lamar. Good morning.
Good morning.
I'm Shannon Andrews, Chief Equity and Inclusion Officer at Cook County Health. I'd like to thank President Preckwinkle and Mr. Rocha for their commitment to achieving health equity. And with their leadership, we are moving in step together towards healthcare equity and justice. Across the country, due to inequities in access to care, systemic racism, a history of mistrust and disinvestment in underserved communities, it is easy to see why there are disparities in healthcare clinical outcomes. If these challenges are left unaddressed, the gaps will only widen, and we will see an increase in preventable sickness and death. We've shown that we can come together as a society to tackle COVID-19 and bend the curve. Here at CCH, through our ongoing healthcare equity initiatives and the Change Institute, we believe we can put that same laser-like focus into improving clinical outcomes. There's so many factors that play a significant role in a person's health: education and employment opportunities, access to food and housing, transportation, safety, and of course, access to care. Enhancing that access to care and care quality is the first lever that we can pull. It is within the wheelhouse of what we do here at CCH every day. With the leadership of Drs. Warrior, Patel, and Dookie, we will continue the work to ensure that everyone is getting the care that they need, when they need it, and regardless of any social risk factors. For almost 200 years, equity has been at the core of what we do, and we recognize that we can do more, and we will. Now I would like to invite Dr. Warrior to say a few words. Thank you.
Good morning.
Good morning.
I'm Lakshmi Warrior. I'm the Chair of Neurology here at Cook County Health, and I am the Interim Director of the Neurosciences Service Line. Stroke is one of the leading causes of death and disability in the world. Every 40 seconds, someone in the United States dies of a stroke. In stroke care, we have something called the golden hour. This is the time interval which spans between when a patient develops stroke symptoms until they receive medical care. After a patient develops stroke symptoms, every second is critical. For every minute a stroke goes untreated, nearly 2 million brain cells die. So there's an incredible sense of urgency. We need the same sense of urgency in the prevention of stroke and brain disease. We need to invest in the health of our communities by ensuring people understand their risk factors and by connecting them to resources to address and treat those factors. We know our patients are at higher risk for developing a stroke and at higher risk for poor outcomes. We know that younger Black communities are almost 4 times more likely to have a stroke compared to their white counterparts. We also know that regardless of gender, Black patients are 2 to 3 times more likely to die from stroke than their white counterparts. When I first came to Cook County Health about 10 years ago, I was shocked to see stroke patients on average a full decade younger than the patients that I had seen in my training just across the street. What I learned was that this disparity is caused by social inequities, like food insecurity, poverty, and lack of access to health care. Our vision for the Neurosciences Service Line as a part of the Change Institute is to transform what we think of as neurological care. Our vision for the Neurosciences Service Line is to provide a full transformation. What if we focus not only on providing the highest quality and cutting-edge treatments for neurologic disease after it occurs, but we also invest in the communities of Cook County to improve brain health and prevent diseases like stroke from happening in the first place? What if neurological care and brain health no longer starts in the clinic or in the hospital, but begins with the patient in their homes and in the communities where they live? We envision the creation of a patient-centered approach, which starts with brain health and prevention and is poised to provide the highest level of care for all the patients of Cook County. The diseases that myself and my colleagues are treating have similar underlying conditions, and unfortunately, a similar impact on the patients that we serve. By working to address the underlying inequities in our communities, we can prevent neurologic disease before it happens. Thank you. I'd like to introduce Dr. Urjit Patel.
Thank you, Dr. Warrior. Good morning.
Good morning.
I'd like to thank President Preckwinkle and Mr. Rocha for their focus and attention on cancer and addressing the disparities that exist. One of the many things we do well at Cook County Health regarding cancer care is offering access to clinical trials. We do this through an NIH, National Cancer Institute grant mechanism that is specifically targeting and addressing minority and underserved populations to make sure they are included in treatment, investigations, and future research without which they might otherwise be excluded. As such, the NCI acknowledges Stroger Hospital as a critical access point for minority and underserved populations to access this critical opportunity. Two specific areas that we're focusing on this year. The first is the Cancer Moonshot Biobank. This is a national study that involves collecting specimens and blood over the course of treatment of a patient's cancer. This is going to lead to breakthrough treatments in the future, and if we are unable to include a certain patient population, future generations will not benefit from this critical research. Our grant here at Stroger Hospital ensures that our patients are included in this critical work. The next is something called the Early Onset Malignancy Initiative. This is a study specifically looking at cancer as it affects young patients or patients early in their lives. We know that there are many social determinants of health, and of course cancer has an important genetic component. There's no way we could possibly address disparities in racial or ethnic populations without including all patient populations in this type of research. As such, again, this study is specifically including patients at our hospital. We know minority patients are at greater risk for cancer deaths as well as poor outcomes. A few examples. We know Black men have the highest rate of prostate cancer in the United States and a death rate from prostate cancer nearly double that of all other racial groups. We know Hispanic men and women are twice as likely to get liver cancer and to die of liver cancer than non-Hispanic whites. Another example, looking at women, Hispanic women are 40% more likely to develop cervical cancer and 30% more likely to die of that cancer. So we know that cancer disproportionately affects certain racial and ethnic minorities, and our goal here is to put an end to that. Areas of focus. Since launching the Change Institute and the Cancer Center, we've initiated several programs designed specifically to address some of these issues. We launched a patient navigation program this year. Cancer care is complex, and navigation through that is often difficult, and this is specifically focusing our patients' population to navigate the process for all of our patients. Number two, we started our genetics counseling and testing program. Again, getting at the fundamental causes of cancer in all of our patients so we can better understand this for future generations. Finally, number three, we focused on HPV, or human papilloma virus vaccination. Here we have a vaccine that can actually prevent cancer, and it's being underutilized throughout society. What better way to treat cancer than to make sure you never get it in the first place? This year, President Biden announced an ambitious goal to dramatically reduce the rate of cancer death towards the end of ending cancer altogether. We want to make sure nobody is left behind and everybody comes along to a future that is cancer-free. Thank you.
Thank you.
Sure. We estimate, given the size of the award will be about $250 to $1.5 million, that we can accommodate probably about 20 to 25 successful grantees.
And everyone that each place is going to have a certain idea of how they're going to tackle this, but what are some examples?
Great. So we're going to be looking at kind of four large buckets, if you will. So positive youth engagement to help them, kind of direct them into more positive things and keep them out of harm's way in terms of some of the youth violence and some of the other things that can happen. We're going to be looking at things around opioid involved folks, both in terms of diverting them from the from jail, essentially, to treatment, but also in terms of preventing folks from having overdoses with our Narcan program. Some mental health services around helplines and things like that for some of the suicidal ideation and things, and a few other things. And so what we're doing is we're giving them large buckets of areas, and then we want to encourage their own creativity and innovation to figure out what solutions work best at the local level. Certainly, certainly. And this is where kind of the health atlas can come in, because there can, you can use that data to kind of target, what some of your other risk factors are, contributing risk factors might be. They'll be working with us and our team. We have Jennifer here who leads our unit in behavioral health. And so we'll give them technical assistance. We're going to do a lot of education. I won't call it hand-holding, but really education to introduce other folks who may not be familiar with the grant-funded process to get involved. Sure. That's right. So we're targeting them. We have a very robust network of community folks that we engage with on a regular basis, and we're building that database all the time. We built a good track record of trust over the last 2 years. We're in their homes giving vaccines. We're doing mobile clinics giving vaccines. So we start with the trust, and then we start with the open call in some of the educational sessions for anybody, just to kind of walk you through how simple it can be. And then we kind of hold your hand through the process. What does it mean to design a program, to have that scientific rigor there? What does it mean to report on time? What does it mean to be a fiduciary, to be responsible for these? What does it mean? Those types of things. So it's basically through education and through network and through working with key stakeholders to encourage this, and kind of dipping their toe into the waters of grant-funded programming. This is going to be over a course of 4 years. That's right. Thank you.